Hello and welcome. Thank you all for joining us today for Past Life Forum entitled When Data Talk, Advancing Health Equity with Data and Analytics. My name is Hallie Gertz. I'm the Director of Communications and Advocacy for the Programs and Innovation Division at PATH, and I'll be moderating today's conversation. Before I introduce our panelists, I'd like to share a few logistical details. First, we want to hear from you. In addition to sharing your thoughts and questions and experiences over the next hour, I also invite you to converse and share online by using the hashtag PathLifeForums, all one word, and tagging us at PathTweets, again, all one word. Also, please know that this call is being recorded and will be distributed for those unable to join us live today. I also want to say a special thank you to the Tableau Foundation for their sponsorship support of this event. PATH is grateful for Tableau's many years of partnership and commitment to developing and advancing a comprehensive data-driven approach to health. Finally, I want to thank all of you for joining us from all over the world. Philanthropists, government representatives, corporate partners, and peers, we appreciate your interest and participation today as we all work together to advance global health equity. And I'd like to start by asking all of you a question. What is one way that you use data in your everyday life? Please type your answers in the chat box, which you can access at the bottom of your screen, and send your response to all panelists and attendees so we can follow along. To start, personally, I'm committed to tracking my number of daily steps with a 2021 goal of 10,000 steps per day. Currently, I'm averaging 9,728 daily steps. So I still have a little bit of work to do to hit my goal, but it's something that I track every single day, usually a couple of times. So please add the types of data that you use in your daily life, again, into chat. We have a couple of budget folks that are using budgets, information to balance checkbooks, hours of sleep, I like that one, expenses. So again, just a nice demonstration that we all use data in a lot of different ways through our daily lives. So as we continue the conversation over the next hour, please keep sharing your questions and comments in chat. We will be monitoring these channels and saving time at the end of the hour to pose a few of your questions to our panelists. Now, turning to our speakers, we are so honored to be joined by this incredible group of people. We'll start with opening remarks from Neil Myrick, Vice President of Social Impact at Tableau and the Global Head of the Tableau Foundation. Then we'll move into a conversation with Dr. Smisha Agarwal, Assistant Professor at Johns Hopkins Bloomberg School of Public Health, Dr. Hana Bilak, Malaria Technical Advisor at PATH, and Dr. Eric Mukomena, Director of the National Malaria Control Program in the Democratic Republic of the Congo. A huge thank you to all of you for joining us today. But before we engage our speakers, I want to share just a little bit more background about today's conversation. I think we can all agree that the digital revolution has impacted all facets of life, including health. And over the past decade, PATH has committed to partnering with countries and communities to advance health equity through digital and data transformation. The COVID-19 pandemic has only highlighted how valuable the growing ecosystem of data generated through the use of digital tools and technologies is in finding answers and making decisions that we know can affect the health of hundreds of millions of people. You can see just a few of the data visualizations that PATH teams have created to support the COVID-19 response over the past months. These range from consolidating diagnostics market intelligence to support procurement decisions, to dashboards that highlight daily gaps in medical oxygen supplies, to those that compare global essential health service policies. The ecosystem of data which these dashboards pull from are built by compiling billions of individual data points. For example, if we were to travel together to rural Tanzania, we could observe Saida receiving her 5th dose of the DTaP vaccine. Her electronic immunization record is updated by a community health worker, and a new data point is entered into the health system. Just a small addition to our data ecosystem. By leveraging the single piece of data, Saida's father will know what vaccines remain for her to be fully vaccinated. A health worker can report on the stock of the vaccine in the community, and the Minister of Health can celebrate the increased immunization coverage rates in Tanzania. Each of these events makes use of just a single data point. This is the power of data within health systems. Digitization enables faster analysis, allowing us to generate new insights more quickly. However, digitizing data is insufficient on its own to prompt actual changes in health outcomes. As data improves, the opportunities to use this information increases, and it becomes even more important to consider how to systematically support the use of data for decision-making and informed action. The next health revolution will belong to the communities that are able to tap into this data and use it to transform their lives. At PATH, we believe that data visibility is often the first step towards solving systemic problems, but the shift from using data as a reporting tool to using it as a decision-making tool is where the power truly lies. So I'm super excited for today's conversation, which will explore how our speakers are using data and analytics to improve health system resiliency and realizing the full value of health data by creating a comprehensive approach to data-driven health. So with that introduction, I'd like to turn it over to Neil Myrick for some additional remarks. Neil?
Thank you, Hallie. And just want to say thank you to PATH for having me here today. And I want to give a special shout out to our country level partners and representatives. I've had the pleasure of getting to know some of you over the years and traveling and seeing your work in country. And I have to say that it's really been one of the highlights of my career to get to know you and see the work that you do every day. Today's this year's kind of special, and this month in particular. So last month, Tableau Foundation celebrated our 7-year anniversary. And 7 years ago this week was when I had my first meeting with a vice president at PATH to talk about work that would really fundamentally change the work that Foundation does globally. And most of you who have heard me speak at global health convenings and conferences and other places may have heard this story, but it's really one of my favorite stories to tell. So 7 years ago this week, which was not even a month after we launched Tableau Foundation, I had coffee at my favorite coffee shop here in Seattle called Milstead with a vice president from PATH. And she talked about what PATH does. We had some coffee and talked. And then she asked me one of the most profound questions I think I've ever heard, and one that would really forever set part of the way that Tableau Foundation works from then on, now over these 7 years. I remember she tilted back in her chair and she looked me directly in the eye and she asked, "How would you like to help us eliminate malaria in Zambia?" And it was such a profound question because it wasn't a question for funding. It wasn't a question for donated software. It was a question asking for partnership. Now, we of course said yes. And for us, it was a risk. We were a brand new foundation. This was really our first significant grant. We hadn't even chosen global health as a focus area. But we knew the reputation of PATH. And we said yes to nothing more than just a vision and a dream that data could help countries like Zambia fight one of the most deadly diseases ever. Now, over these 7 years, we've collaborated deeply with PATH, and that's been really a special part of this relationship. Our grant was not transactional. It was a partnership. It was a deep collaboration, and we've learned a lot. Over these 7 years, PATH has now used the digital platform that they built, and we've been lucky enough to help them with, to support global health projects in more than 22 countries. They were able to respond to emergencies, like helping the DRC respond to their Ebola crisis, and most recently, use the platform to help countries like Senegal mount an impressive fight against the COVID-19 pandemic. And even today, PATH is using data to tell the story about the needs of oxygen. And they're using that story to help raise more than $1 billion for oxygen to help those suffering from COVID-19 in India and other countries. So it's been a real pleasure to work with them, help them build their digital infrastructure, and then in partnership with them, help those of you working at the country level use data to improve health outcomes for your citizens and countrymen. So as we kick off this event today, I thought I would just share a couple of lessons learned over the years through the partnership with PATH. The first lesson that I want to share is we always suggest with all of our partners around the world that wherever you are in your journey with data and digital tools, we encourage you to start with the data you have and build iteratively from there. Our most successful projects around the world are ones where people start with what they have, they learn and they grow step by step by step. That's in opposition to some projects that we've seen where people spend a whole bunch of time investing lots and lots of money and time building this massive sort of data machine and then launching it all at once. That typically doesn't work as well as if you just build with what you have and grow incrementally over time, because your needs will adjust as you learn. One of the most important lessons that we've learned through our work with PATH is that it's really important to engage the communities that you're working with and the people that will be using the data visualizations that you develop and have them help develop the visualizations. I remember when we first started working with PATH, we connected Tableau data visualization experts with malaria experts, and they built these amazing visualizations to tell the story of how malaria was behaving and responding to various programs and treatments in Zambia. We then workshopped those visualizations with Ministry of Health staff. And believe it or not, every single one of the visualizations that were developed had to be completely redone. What we learned is the way that the experts saw data informing the world was not the same way that the practitioners on the ground needed data to inform their world. So in every project that we do across the world, whether we're working on homelessness, gender equality, global health, or some of the other issues we focus on, we always encourage deep collaboration with the decision makers and the communities who will be using the data. We also have learned over time that we need to broaden the term of what it means to be a data person. What we've learned is when we started our work as a foundation, we would fund capacity building and we would fund people to build, to learn Tableau and other data tools and to build visualizations. What we've learned over the years is certainly that has to be done at a certain level. But what can be done faster and what can be done at a larger scale is not necessarily teaching people how to build visualizations, but teaching people how to use visualizations. When we did an Ebola project in Guinea in 2015, what we learned actually is we could build visualizations and then have an information manager at the country level, who then we taught how to use the visualizations to make decisions and inform decisions that she was making at the local level. She didn't need to learn Tableau. She didn't need to learn what an R value is or a trend line or an average. She simply needed to learn how to interpret the visualizations and in order to help her make decisions about what needed to be done on the ground each and every day. The last thing that we learned that I'll share real quick is that there's really immense value in creating a shared language around data for progress. So when you invest in building the digital infrastructure and the ways to collect data, the ways to store data and manage it, it's then important to actually share those data with as many people as possible and create a shared language around data that helps people stay informed about what's happening each and every day for whatever issue they happen to be working on. We work a lot of times on focusing on changing the concept of measurement and evaluation, for example. So certainly there's value in looking backwards and doing RCTs, random control trials, in order to understand whether a program worked as expected. But what we're finding is it's more important, equally or more important, to have a frequency of data that actually informs day-to-day decision making at the program level, so people can see and understand what's happening and make better informed decisions about how to respond. I remember being in Zambia a few years ago and hearing somebody tell the story about how historically they would collect data and then they would have their data meeting every July. And they would use those data to understand what programs were working where and make decisions about what they needed to do differently. After we invested in this project and program with PATH to help Zambia eliminate malaria, we learned that we were able to use products like DHIS2 to collect data every Friday. And Zambia was able to go from having data meetings once a year to having data meetings every Thursday. And the frequency of those data allowed them to actually, local district health director, see and understand what's happening on a week-by-week basis. And what we like to say is, in that case, information about the disease was spreading as fast, if not faster, than the disease itself, allowing those health directors to make fast, informed decisions about how and where to allocate their scarce resources. I'll wrap up this morning just by saying that our work over the years has expanded to include work on homelessness, racial equity in the US, gender equality globally. And what we've learned in our fight for equality, whether it's health equity, gender equity, racial equity, is that we need to focus on, information equity. And information equity is important so that everybody has access to information that they need, whether they're at the community level or at the government level, in order to make decisions and see and understand what's happening about their community. That's why at Tableau Foundation, one of our major focus areas this year is really on democratizing data, making sure that people have fair and equal access to those data so that they can actually be more equally and more informed about what's happening in their community and the things that they can do to help improve outcomes and conditions for people and community members they care about. So I'm excited to be here today. I think the conversation is vitally important. I think we've learned a lot of lessons over the COVID-19 crisis that hopefully will help inform decisions moving forward about digital health, digital equity, and achieving that goal that we all have of health for all. So with that, I'll close and hand it back to Hallie. Thank you very much.
Thanks so much, Neil. I am really looking forward to the chance when we can once again have a cup of coffee at Milstead and talk about all the ways that PATH and Tableau have worked together and will work together to continue this democratization of data. Thank you so much for sharing some of those lessons with us around starting with the data that you have, focusing on collaboration, broadening the definition of what it means to be a data person, which now means I think I can call myself a data person, which I'm excited about, and creating that shared language. And I think that's part of what we're hoping to do today. So starting our discussion with our other panelists, let's talk a little bit more about this concept of democratizing data. And specifically, I'd like to start by thinking about some of the current and future opportunities you all see around the use of real-time data to address emerging and ongoing health threats. So Dr. Mukomena, thank you so much for joining us from the DRC. We'd like to start with you, and I'd really appreciate getting your insight here and thinking about the COVID-19 pandemic and how it's really highlighted the benefits of real-time data and the need to put those data in the hands of decision makers with frequency, as Neil mentioned, and as fast as possible. How has the DRC been enhancing data access and use to respond to health challenges like COVID-19 or malaria or Ebola? Dr. Mukomena, we're turning over to you. There we go. We're not able to hear you. We'll give you just a few more seconds and then we might, oh. Want to try again? So we'll hold that question for just a second, and we'll see if we can get our technical difficulties sorted, which I know we all have deep empathy with after the past year plus of working often remotely and in low connectivity places. So we'll shift quickly over to Dr. Agarwal. I know that you, along with Neil, sit on the board of Digital Square, which is one of our path-led initiatives. And so thinking about the work of Digital Square along with your own work, what do you think are the most important considerations in supporting the development, implementation, and use of sustainable and impactful data systems, tools, and approaches?
Thank you, Hallie, and thank you for this great introduction and discussion so far. We live in a time where, given our level of digital connectivity, as we saw in the chat over the last couple of minutes, a lot of our by our actions, they leave a data footprint. And if we harness and use these data appropriately, there are tremendous opportunities to predict and in some cases contain epidemics. So just from carrying our mobile phones around, a lot of geolocation and other data passively and actively collected. And at the start of the pandemic, we were in conversations with telecom operators to use these mobile data to study mobility trends and assess if and where individuals were following what we're calling non-pharmaceutical interventions, so social distancing and stay at home and other regulations that were being implemented. So at a national level, this sort of access to data can really help governments plan an effective response, right? They can see what kind of regulations they need in place to be able to actually not just implement, but also ensure that citizens are adhering to these regulations. But we've seen in multiple countries during COVID-19 that such activities can only be successfully undertaken where there are clear privacy and data use regulations in place. And not only clear regulations, but also clear communication and trust in the governments that are implementing these regulations, especially in cases where data are being passively gathered from consumer-facing apps. So I think that's regulation is one key that I really am. I think it's so critical because we have to keep our eye not just on the current pandemic, but also on future pandemics, and which are a certainty. And Dr. Tedros, he recently identified that lack of sharing. It's a major barrier to progress that was made during this year's World Health Assembly, as well as the politicization of data. And so we really do need to invest in these normative guidelines so that we can be ready. I think Digital Square has really been leading a lot of the thinking on how, as a community, we can pool our resources and skills to build tools that adhere to certain baseline standards and that can be easily updated and used by governments in various country settings. And I think through the advocacy work that's been ongoing, a lot of global agencies as well as country leaders are seeing value in investing in the necessary digital architecture that makes data sharing possible. So not just in widgets and short-term interventions, but in the architecture, which is not always obvious to the naked eye, so to speak. It's not where we can count X number of people used our widget, but it's supporting that architecture. And I think these are steps in the right direction. I will pause there. I have so many more sort of thoughts on this question, but maybe I see Dr. Eric is back on, so I'll give him a chance to go.
Thank you so much, Smisha. I really appreciate that idea of sort of going back to our childhood almost, and sort of remembering the importance of sharing as we think about data. So all of those lessons that we learned growing up are coming back to be important components as we think about how to leverage, how to thoughtfully leverage data to address some of these large health challenges. So Dr. Mukomena, I see I'm seeing you again. Thank you so much for joining us and for fighting through some of the connectivity problems. So turning back to you and thinking about specifically how the DRC has been thinking about enhancing data access and sharing, what are some of the things that that your government and Ministry of Health have been supporting in this space?
Okay. Thank you very much. Can you hear me? Hi? Okay, it's nice. Okay, let me share also from our side in DRC, what is going on here on the field. For sure, the COVID-19 struck us. We didn't prepare very well how to deal with the COVID. When the COVID arrived, we faced a shortage of drugs. It was terrible. Quite 6 months without drugs. And to share this information for drug management, it was very tough. And then we started getting support from Part Congo, Part DRC, which work with us, and we set up a CUSP. CUSP is a kind of center of operation for emergency to collect in real-time data. And currently, we are working. We're still working with Part Congo, with Part Geneva, and all donors and partners to set up this CUSP. CUSP is a center of emergency to how to respond and to share data in real time. Despite that, since 7 or 10 years, we are working together with partners to set this DH2 logistic, and currently still it's very fair, and the coverage is not very top. You know, here internet is still a problem in DRC, in Africa, and common in Africa. So to collect data in real time with this problem for internet, it's very difficult also. And despite that, we continue to work on the field with the University of Geneva. We are collecting data so that it can be shared in real time to improve access to healthcare. We have done it with University of Geneva. I think we'll extend the coverage of this job we've done with University of Geneva. This year, it was the first time for us in DRC to digitalize the mass campaign of mosquito nets. We digitalized mosquito net campaign, but it was also challenging, but we did it. We're gonna publish a paper in Malaria Journal very soon, shortly. We're gonna publish a paper with Malaria Journal to share this experience in a challenging setting as Congo, to digitalize a campaign for equity, for health manager to household to access to mosquito nets in real time. So we are doing it with support of Part Congo, with Global Fund and USAID and the USAID, we call it USAID. So on our side, but still for drug management, use of drug remains a problem. The Minister of Health in DRC is trying to set up a logistic to share monthly data on use of drugs in our system. So monthly we share in 16 provinces, we share data on drugs management so that we can detect earlier a shortage of drugs. So this is our experience, our young experience in DRC.
Thank you so much for sharing, Dr. Mukomena. I think it's really interesting to hear the variety of different ways that the DRC is leveraging digital tools and technologies to support improved health outcomes from, as you said, the digitalization of campaigns to looking more at supply chain or logistical issues, as well as the supplies of medication. So I think that's really exciting to sort of understand the vastness of the applications there. And Hana, I know that you have a lot of experience thinking about the vastness of applications of both data and digital tools and technologies, and that you've been involved for a long time in thinking about how to leverage some of the learnings from our Visualize No Malaria project that Neil mentioned, that was birthed in a coffee shop in Seattle 7 years ago. So thinking about that particular project, how and the innovative technology stack that was developed for that initial demonstration, I think we realize the importance of considering this full data lifecycle, from how data are initially collected and stored to how they are analyzed and visualized, and finally how they are used to support decision making. So thinking about this model and some of those learnings from BNM, how are you applying those in other health areas or within other projects now?
Thank you, Hallie. Thank you so much. And it's really a pleasure to be here today with all the other panelists. Yeah, so indeed, you know, often we talk about the visualizations and the dashboards, but there's a lot that's going on behind those dashboards and throughout the entire life cycle, data life cycle. So recently, and we started working on these projects just over a year ago, with funding from the Gates Foundation, on looking at how we could sort of leverage emergency operations center that Dr. Mukomena alluded to, and how we could leverage their capacity in data analysis to support malaria programs. And so as we were beginning these projects in Senegal and the Gambia, COVID-19 hit the planet. And we were able to sort of very quickly focus from the malaria side of things to support EOCs and our national level partners on COVID-19. And at the same time, we also received funding to do similar work in the DRC. So starting with COVID-19 and working on the malaria integration piece. And so for example, in Senegal, where in 2016, the Ebola epidemic had really grave consequences across West Africa on malaria, because people were too scared to attend health facilities, and a lot of the gains that had been made in malaria were lost, and it cost a lot of lives. And so there was really a big scare that this would happen again. And so we were using the dashboards and the data systems that had already been built for malaria. We were able to track health facility attendance across Senegal and use that as a proxy for you know, what might be the impact of COVID-19 on malaria. And so this gave the National Malaria Program the opportunity to follow this data and really look at where there were issues and if there were some areas where people were no longer attending health facilities. So that's one example. And then in DRC, we started the project by supporting the technical secretariat. So the technical secretariat was a structure, an ad hoc structure created by the government of DRC to respond to COVID-19. And it sort of acted as like a super emergency operations center. And together with our partner Blue Square, we were able to work with the different commissions within the different committees within the technical secretariat to really look at all the different data sources that were needed to fully comprehend the extent of the COVID-19 epidemic in DRC, and build digital tools to be able to collect data at different levels. So for example, case investigation data, but also data at ports of entry for people traveling, and then lab data for results of diagnostic tests. And by really building these modules using the DIHS2 system so that it would be able to be used by the existing health monitoring and information system within the DRC, we created these modules that all then fed into one dashboard where the technical secretariat was able to track these different data sources and data indicators to get a picture of the COVID-19 pandemic in DRC. So the other thing, and maybe the last point, and so then we continued this work and started working with the National Malaria Program and with Professor Eric, and so, you know, building data visualization tools to be able to track malaria indicators, and also trying to focus on those logistical indicators that he was mentioning, so that we can track, you know, when there are stockouts at different health facilities. And then another dashboard that that we've been able to support with the EOC and the Division of Epi Surveillance in DRC is a dashboard that looks at cases and deaths for 22 diseases that they were already tracking, but now they have one single dashboard that incorporates this data for 22 diseases, including malaria. And then we can sort of work for every disease on refining an algorithm, an outbreak detection sort of alert threshold, which will then alert them in real time when they have a potential outbreak of a disease in one area of the country. And given the size of DRC and it's also really important, I think, to remind people that in DRC, besides COVID-19 and malaria, there are a number of epidemics happening in, you know, at a single point in time, including Ebola, measles. And so having this dashboard and being able to track these diseases in real time and identifying outbreaks is quite a powerful tool.
It's really exciting, Hannah, to hear your reflections on this, and it actually mirrors a lot of my own experience working more focused in the digital health space, of this movement from more siloed approaches or individual apps to a more consolidated, integrated approach, and just the importance of that, of having a fully interoperable digital health system, but also like a fully integrated and interoperable data system or data sources, and that again is sort of where the power of this data ecosystem really lies. So thinking about not just, you know, the past year, past couple of years, but looking forward, one of the questions that has come up in chat and that we were talking about a little bit in sort of our prep sessions is how to ensure that these digital and data tools and approaches that we're discussing are truly sustainable and accessible to all communities. And Smisha, I'd love to get your reflections on that. And also thinking about how do we balance this idea of data privacy, or you know, data privacy as a human right, with the concept of data democratization or data as a public good.
Yeah, and I see there's a question in the chat about this too. So I know this is sort of front and center on a lot of people's minds. I think the tension that we face in public health between public good, the common good, and individual rights has been going on indefinitely. right? And in the last year, we've heard often of civil liberties as often portrayed as a sacrifice one needs to make in the fight against COVID-19. And it might be, I think, more new to certain parts, right? But other countries have already grappled with that and during prior epidemics, right? In some societies, people accept this sacrifice as a modest sacrifice for common good. And in others, they actively protect their own interests. And I think as more and more individuals acquire better digital literacy, I suspect we'll see a lot more of this tension, right? Where individuals have some understanding of how their data are being used, but it's just enough to make them suspicious of it. And so I think maybe I preface it with sort of this because really to talk about, there are some common principles that guide data privacy and security. There are also cultural contexts that we must be aware of, right? Because no one way is necessarily a right way when it comes to this tight balance. And I think we have to be aware of the role of culture and in contributing to individual understanding of privacy. Irrespective of that, there is a lot of need for legislation in this space combined with transparent public oversight. Data are powerful, but with our advanced computing capacity and our ability to process large volumes of data, we can come away with critical insights in the matter of a few seconds. But really to be able to tap into this full strength of the data, we need the data, one, to be representative of the population, and two, to be shared across groups. And to do both, we need certain policies in place. So I spoke previously about sort of aggregating data, nationally and sort of its role in planning. But I think the last two panelists really highlighted the value at the community level. And to do that, often digital systems may be inadequate and paper systems might be appropriate. And there might just be a need to set policies so that we're actually accessing that data systematically, and we are using that data, right? And so where digitization is possible, where there is enough of an infrastructure to facilitate digitization, of course, the strength of sort of immediate digitization and use of data can really sort of shed light on communities that are hard to reach or that are more vulnerable. But even in the absence of digitization, there need to be investments in ensuring that those communities are represented in the data. And so I think that's always the fear, right, in the digital health space, Hallie, that we share, where while one section of this world is sort of leapfrogging ahead, we are leaving behind another that's not yet part of this digital transformation. And so I think ensuring that section is also represented is so critical to equity.
Yeah, those concepts of equity and representation are so essential in all aspects of our life and of our data lives, especially when we are increasingly using that information to make decisions that impact all of us. So thank you so much for raising those considerations. And Dr. Mukomena, as we're sort of thinking about what about this concept of a sustainable data use culture and democratizing data, we also have to think about the healthcare workers and ensuring that they have the capacity that they need to be able to really maximize the use of these tools and systems, supporting that flow of information from all levels of the health system. And as you mentioned, DRC is a very large country, and so how are you thinking about that and sort of working to enhance the capacity of your health workforce? Oh, and you're on mute.
Okay, thank you very much. The problem is that there is a need, for sure. There is a need. The need is there, and it's very huge. So how to start? We got change we started here in Kinshasa, but we need to decentralize. You know, according to the size of the country, we can't build such a system even only in Kinshasa. We need to start somewhere in the provinces. Provinces, we have 26 provinces, huge. As my province, for instance, is very huge, 200,000 square kilometers, my province, where I come from, in the southern of DRC, close to border to Zambia. We need to decentralize the tool. The tool needs to decentralize because it's very difficult for a guy who is in Kinshasa to analyze in Kinshasa what is going on in real time in a district. It's very tough. We have 19 health districts. It's huge. It's huge. So there is a need to decentralize this tool. And then there is a need also to train people, I don't care at this stage, me, culturally, I don't care with democratization and democratization and the visualization of data. Currently, it's not a problem, but will be a problem in the future. Culturally, it will be a problem in the future. So me, I will advocate first for more resources, and train people. When we did this digitalization in January in Congo Central Province for mass campaign, net mass campaign distribution, I didn't. For me, first, I was afraid that people from villages, they will not manage to an Android, a soft Android. It will be very tough for them to, but they manipulate it easily and with a short training for about 1 day. 1 day they were able to manipulate this Android. So I think the need is there, but we need to mobilize resources, enough resources, so that we can go forward. When the data speak, the data speak every day. They speak every day, but people, they don't understand because they don't see. Because they don't see. For instance, doing mixed interventions, analysis of data with the support of PATS and the WHO Geneva. What we have, we used to say that resistance, insecticide resistance is increasing. But people, they are discussing, they are not really confident that there is an increase of resistance. But when we did this exercise with PATS Congo and the PATS DRC, PATS Geneva, and the WHO Geneva, we realized that data were speaking, but people, they were not understanding. So I think we should go forward and train people, mobilize resources so that we can improve our health system. There is a need also.
Thank you so much, Eric. I think that resonates with many of us that have worked in this space before about the need for additional resources and additional training and capacity enhancement to really ensure that we're using these tools and technologies to their fullest. So Hana, before we turn over to audience Q&A, I was just wondering if, based on your experience, you have any other suggestions on things that we really need to be doing to ensure this data use culture, this global data use culture that we're building is truly sustainable and accessible.
Yeah, thank you. To me, one of the main things that we need to keep in mind is that we really need to make sure that we're not building tools or building systems that are not based on based on a country-led decision. And I think it's very important that before we come with a ready-made solution, that we start off by being solution agnostic and really take the time to understand what the issue is, what the existing systems are, and what are the existing challenges or strengths of the system, and then really build together with the people who will be using the data. And I think Neil said that in his opening remarks, and I think that is really essential, that the people who will be using the data need to be part of the development of the solution, because ultimately they're the ones who need to tell us what they need and what do they need to be able to do their job. And so we've seen throughout the years in malaria programs, a lot of projects that came with ready-made solutions, and then you ended up with countries where there were so many different solutions, and then health workers had 5 different phones for each project trying to report. So I think, this was already a few years ago, so I do think that we've moved away from that. But I think that is, to me, that is the country needs to be at the center of the solution. And for example, in DRC, and taking into account the fact that there are huge connectivity issues, and so maybe, as you were saying, Smisha, maybe digital isn't the solution everywhere, and we do need to consider some level of paper-based, just because people will not be able to share data digitally. The other point, which I think is really important, is that people really need to, the people who collect data and who share it, they need to know what happens to the data, to their data, once they collect it. Because today we have, in a lot of settings, you have people who collect data and then send it to somewhere, and then it sort of disappears in a data void. And it never comes back to them so that they can make their own decisions based on this. And this is what Eric, you were saying. It's really hard for someone in Kinshasa, especially in a country decentralized like DRC, where a lot of decisions are and can be made at the provincial level. So that the data needs to come back to the provincial level in a sort of feedback loop. And I think that to me, it also seems like that would be a great incentive for people to want to, I just personally, I feel that if I was being asked for data and then never knew what was done with it, I wouldn't feel super incentivized to do this and take time out of my working day to do this. And so building that feedback loop is really essential. And then the question of training, and I really liked what you said, Neil, as well, in the beginning about not training people necessarily to understand how the tool is built, but really how to use the tool. And so in the context of the project that I was describing earlier on the support to DRC for their COVID-19 response, but also on the malaria side, all the data feeds into Tableau dashboards, and we are planning, it's a big part of the project is to train data users. So we will be training like very specific technical people, just so that they can maintain those dashboards and add indicators to them as needed. But we do want to focus a large part of those trainings on the people who will be using the data, so that they are able to sort of play around with analysis and visualization and really make informed decision based on that.
That's fantastic, Hannah. Thank you for that response and for those thoughts. It's hard to believe, but we're almost at the top of the hour. So I'm going to move into our closing and offer each of you an opportunity to share one final thought with our audience. And I think we can frame it around Dr. Mukomena's suggestion, sort of noting that data are always talking. We're just not always listening. So what is one thing that you'd like to share with our audience of something that they can do to support this democratization of data and ensure that we all have the opportunity to listen to what the data are saying? And Dr. Agarwal, I think we'll start with you.
Sure. Actually, I think my summary points really reflect a lot of what Neil and Hannah and Dr. Eric have already said, which is really to democratize data, ensuring that communities, one, have the right data, two, have the capacity to then use the data for local innovation, for local impact, three, that they can feed that back to inform policy and to inform budgets that directly affect their communities. So whether it's decentralized, then at the district level, and then that they have more data, so they have the right to take the right action for their communities. So I think really it's so, everything about data is boring and induces fear in people, but it is actually the tool to ensure that you can access your rights, that you can ensure you have your rights. So thank you for that.
Fantastic. I like that. Data is a mechanism. While some might think it's boring, it actually allows us to achieve equity and provides access to our rights. That's fantastic. Hana?
Yes, I completely second that. And to me, making data available to the people who need it and who can use it, it's really a question of moving from from reacting to data. And so as Neil was saying, when you have meetings to look at data from the past year and sort of react to it. And I think this digital tools and making those available to people who need to see those data really mean that we can use data proactively to make decisions rather than just react to them. And then we can also even sort of add in, based on these data, we can build models, we can inform models, and then we can even predict the future, so to speak, because the more data we have, the better the model is. And then we can sort of, in malaria, for example, being able to predict malaria outbreaks in low transmission areas is a very powerful tool, but you can also see how that could be useful for other public health emergencies.
That's really exciting. It's this future of predictive and proactive data analytics and use, which is a fairly significant change from our past of just being informed by the information or increasing awareness. So I think that's all something that we can commit to supporting. And Dr. Mukomena, turning to you, one thing that you'd like our audience to walk away from this conversation with.
Thank you very much. Digitalization can't be only a fashion. We need to make it real and to happen, but it will be very frustrating to someone who is working with data in real time, but not to be able to respond. So we should be keep in mind that while we are improving the surveillance system, we should improve also the response. Thank you very much.
Thank you very much. And I really appreciate that comment of this is not a trend. This is not a shiny thing. Digitization and the democratization of data and data use is a foundational element of our health systems, and we need to think of it as such. So I appreciate that comment. And then to tie just back as we wrap to Neil's comment, I think through this hour, we've realized that we are truly all data people, and that we all have a role to play in listening to the data when they are talking to us and supporting that listening for all people. So thank you to our wonderful panelists, to Dr. Bilak, to Dr. Agarwal, to Dr. Mukomena, to Neil and the Tableau Foundation for their support of this event and this conversation. And thank you to all of you for tuning in from around the world, for your participation and your thoughtful questions. And I'm sorry we weren't able to get to all of them, but we do hope to continue this conversation on our social platforms. And whether PATH is new to you or you have followed our work for a long time, we really appreciate you taking the time to join us today. Please stay in touch. We hope that you'll log in for a future PATH Live Forum event. And in the meantime, please take good care, and thank you again for joining us.
Thank you. Bye.